Would you like to know a bit about how we can use what we know about music to help find a new treatment for lung cancer? I'm just going to chat first about the disease that we're researching, lung cancer. Globally, lung cancer is the most diagnosed cancer, with about 2.5 million new cases every single year. Unfortunately, it's also associated with the highest amount of deaths, with about 1.8 million people sadly passing away from the disease every year. So, as you can imagine, with a disease of this severity, we need the best treatments possible at our disposal. At the moment, the main treatments that we use are chemotherapy, radiation, and surgery. Now, it's important not to understate the massive effect that these treatments have had, and they have saved countless lives over the years. But unfortunately, there is some drawbacks associated with these treatments. As many of us know from either friends or family or first-hand experience, there are some really severe side effects associated with these therapies. Secondly, and unfortunately, not all patients will receive a benefit from these therapies. So, for example, only about 40% of lung cancer patients will receive the benefit from chemotherapy that we would like them to receive. So, we need to think of something new, but where do we start? We want to start by finding something new that a drug can target. What do I even mean by target? Our lungs are made up of millions of individual cells. When these cells are healthy, they work together to allow our lungs to function normally and breathe in and out as normal. In lung cancer, some of these cells can turn nasty and they begin to grow out of control and form clumps. These clumps can then grow to form tumours. And unfortunately, this is when our cells and lungs are no longer working as normal and we start to see symptoms of lung cancer, such as difficulty breathing, chest pain, etc. Basically, what we want to do is find something in these nasty cells that's causing them to grow like this. That's essentially driving the disease. And then if we can get a drug to go in and target these drivers, can we bring the lungs back to their normal and healthy function? But unfortunately, lung cancer is a very complex disease, and finding this driver isn't all that easy. Many researchers and doctors have tried to varying degrees of success. But what we want to do is zoom out and unravel the complexity of the disease and see if we can find something new that hasn't been targeted before. So to help to unravel it, we're going to look at another extremely complex scenario, for me anyway, a 100-piece orchestra. In the orchestra, we have sheet music read by great musicians turned into wonderful music. So this should be all we need for our orchestra. But actually, we're missing something important. Even though the conductor doesn't directly play the instruments that you might hear on stage, he's essential to controlling all of these elements and getting them to work together. And it's only with this really precise level of control by our conductor that we get our perfect symphony. We actually see very similar components in the cells in our lungs. Just like the sheet music, the DNA carries the instructions. These instructions are read and translated by the mRNA, who turns them into proteins. Again, when all of these elements work together, we're still missing something. In the cells, we also have a controller. It's called lncRNA. Just like how the conductor doesn't directly make the music in our orchestra, this guy doesn't directly make the proteins in our cells, but he does control everything else. And similarly, it's with this precise level of control that we get our healthy cells in our healthy lungs. Essentially, our healthy cells are like our perfect symphony. But what if something goes wrong? So I'm sure you've heard the phrase, too many cooks can spoil the broth. But have you heard the phrase, too many conductors can spoil the orchestra? Well, it's unlikely because I made it up, but the point remains. So what happens if there's a mix-up in the hiring process? There's too many conductors, they start screaming over each other, all trying to gain control over the orchestra. They lose control over the music, and what was once a beautiful symphony turns into a screeching tragedy. Sorry about that. Similarly, if we go back to our cells, if we have too many of these lncRNAs, they begin to act a bit crazy. They overwork, and ultimately they too lose control over all the elements in the cells. And unfortunately, this can cause the cells to start to overgrow, and this then can lead to tumours and unhealthy lungs. But the question is, can we calm down this chaos and bring back a little bit of that harmony? In the orchestra, if we fire two of the conductors and we have our lone conductor back, he's happy again, he regains control over the orchestra, and we have our perfect symphony back. The question is then, if we kick out two of these crazy lncRNAs, can we get that normal function of the lncRNA back and ultimately get back our healthy cells in our healthy lungs? How are we doing that? Well, in the lab, we can actually grow the cancer cells that have these crazy lncRNAs. So as you can imagine, they grow very quickly. We then want to add a drug that goes in and kicks out these crazy lncRNAs. And if we do that, can we get our cells to go back to normal and stop growing uncontrollably? And it seems these drugs have worked. In the lab, we got 7 different drugs to knock out 7 different crazy lncRNAs. And then, after we do this, we measure how fast they grow. In black, we have the untreated cancer cell, so the one that all the crazy lncRNAs are still working overtime. It grows very, very fast. And then we kicked out our 7 different crazy lncRNAs, and we can see how much the growth slowed in comparison to the untreated cell. Here's a video of how our cells grow over 5 days. At the top, we have the untreated cancer cell. As we can see, it's growing really, really fast and making these clumps like we would expect to see with cancer cells. Down the bottom, we have our cancer cells that have been treated with a drug targeting this lncRNA 6. And as we can see, the cells are growing much, much slower. What's next for these lncRNA targets? Firstly, we want to see if the targets are actually expressed in the cancer cells of many patients. The more patients that express the target, the more patients can receive a benefit from this therapy. Secondly, we need to make sure there's no severe side effects associated with our drug. For example, if our drug goes in to target the lncRNA but accidentally targets something else that's part of the healthy cell, we can get what we call off-target effects, and this is what we want to avoid. We then need to look at drug delivery. Now, I don't actually mean putting the drug in the back of a van, but more so how we can get the drug to the cancer cells. So, will this be via injection, via a tablet? How often will the patient have to go to the hospital? These are all very important factors. Finally, when all of these elements are ticked off, we can bring these lncRNA targeting drugs into the hospital. And hopefully, we can help make more lung cancer survivors.